show. So our final speaker is Dr. Lesley Collier from the Health Sciences faculty, and she's going to be talking about how we interact with our sensory world around us and how that's different for each of us and how that can affect how we behave and how we can use this knowledge to help people as well.
Hello, I'm going to be talking under the Beautiful Minds theme, and my background is in occupational therapy, and I'm really interested in the way we perceive and understand our world around us in terms of sensory experiences. Now, as we all know, our brains are basically a prisoner in our skull, and the only way that you can get information into our brains is by using our senses: sight, sound, touch, taste, smell. But also there's another area, and that's through movement, proprioception, sort of knowing where our limbs are in space, but also vestibular input, so knowing about movement and velocity and whether we're turning, those kind of aspects. So the thing is that I can walk across this room in my high heels and manage not to fall over. And that's because I can tell, using my proprioception and vestibular awareness and my sight, I can tell where my body is in relation to my feet, and I can adjust accordingly the whole way through. The other thing is, we're in this really noisy, busy environment, and yet all of you are able to concentrate on what I'm saying. You're filtering out all this extra information and able to concentrate. So I'm going to be talking about how we use our senses and how we modulate sensory information coming at us. Some of us do really well with lots of information coming at us. We're sensory seekers, we actually go out there and try and get more stimulation. And others are less sensory seeking. We don't like too much sensory information. We need it nice and quiet when we're trying to work. We can't study if we've got the radio on, those kind of things. So using that information can help us actually construct therapies for many patients, as well as looking at the way we operate in our environment. And we're doing research in the Faculty of Health Sciences looking at this approach with people with dementia and other type of cognitive impairment. And what we do know is that if you can modify the sensory demand that people get coming at them, they find it easier to do everyday tasks. So my session is going to be telling you all about these different sensory processing abilities. You'll be able to find out what kind of sensory processing ability you have and how to set up your environment that suits you for the best. You'll be able to find out about your family and friends and what sensory areas they actually have. But also I'll be giving you strategies of how to manage sensory demand and make the most of the way you interact with the environment, and tell you about how we're using different approaches with people with dementia. And I've brought along one or two examples. I've got here things like my vibrating cushion, which we know that vibration, deep vibration, has a very calming effect on the system. And we also use other sensory systems, such as I've got some optic fibres over here as well, where we're using them to actually stimulate responses for people coming out of coma. So a whole stretch of things, right from normal people right through to people with diseases. So do come along. Thank you very much.
So that rounds up our kind of speaker presentation today, giving a flavour of what the festival is about. I hope you've learned a lot and you're excited to come, and we look forward to seeing you all at the festival from the 18th to the 20th of March all across the city.
Thank you.
Done. Shall I press this, Nathan?